Good morning, ladies and gentlemen. A warm welcome to the press conference on European Center for Disease Prevention and Control. My name is Andrea Horvat-Kramaric, Head of Communication and Spokesperson, and I will be moderating for you today. So the topic of our today's press conference is introduction and spread of mosquito-borne diseases, such as chikungunya, dengue, malaria, zika, and West Nile virus infection in the territory of EU and EEA. For that purpose, we have with us today the Director of ECDC, Andrea Ammon, and we have the Principal Expert for Emerging and Vector-Borne Diseases, Celine Gossner. Before we go to the press conference, I would like to give you a few information on our housekeeping rules, as always. So please remain muted while our speakers are talking. Afterwards, the floor will be open for questions. So when you want to ask a question, please raise your hand, turn on the camera, and introduce yourself. Also, you can ask questions via chat, and I will read it out. Also to say, this press conference is being web streamed, and it will be placed on our YouTube channel afterwards. I believe we're ready, and I will give the floor to our director, Andrea Ammon. Andrea, the floor is yours.
Thank you so much, and a good morning also from my side, and very welcome to our press conference on the mosquito-borne diseases. The reason why we're having this is because summer started, and that is when mosquitoes also become more visible and more active. Historically, historically meaning like 2 decades ago, most of the diseases we will talk about today, we had only as imported cases. Now we see them also as domestically acquired cases, and that is due to the presence of certain mosquitoes, where I will highlight 3 of them in the following. We have, as part of today's press conference, also launched reports on the diseases that Andrea Horvat-Kramaric mentioned, but also updated maps on these mosquitoes that I will tell more about. Now, the first one that I want to mention is the Asian tiger mosquito that is called Aedes albopictus, which is a known vector of chikungunya, dengue, and Zika viruses. And that is what we are seeing now, is that this is spreading beyond the southern geographical boundaries in Europe and establishing itself further northwards and westwards. There is another one, the yellow fever mosquito called Aedes aegypti. And that is known to transmit, of course, yellow fever, dengue, chikungunya, and Zika viruses, and can also, under certain circumstances, transmit West Nile virus. Now, this mosquito has been up to now in the EU only in Madeira, where it caused in the year 2012 a huge dengue outbreak. Now it has established itself also in Cyprus. And although it's relatively intolerant to temperate winters, it's not impossible that it will establish itself in other European countries. Now, alongside the observations about the Aedes mosquito spread, we have also seen an increase in the number of locally acquired cases of dengue, with a peak of in 2022, so last year, where 71 locally acquired dengue cases were reported in France and Spain. The adaptation of these vectors to colder climates and their establishment in new areas increase the risk of locally acquired infections and the occurrence of outbreaks, following the introduction of the virus in communities by travelers returning from tropical and subtropical countries. So the sequence is, you need the mosquito, but then you also need, of course, the virus. And usually the viruses come with people from visiting tropical, subtropical countries, getting infected, coming to an area where these mosquitoes are present. The mosquitoes get, when they suck blood, they get these viruses in, and then possible a transmission can continue. Now, the third mosquito that I want to mention is one that is actually native to Europe, and that's the Culex mosquito that transmits the West Nile virus. And in the recent years, we have seen that West Nile virus outbreaks and the number of cases, including severe cases and death, have been increasing. And also the area of the number of new areas that are affected by this mosquito is growing. Last year in the EEA, countries reported 1,133 human cases of West Nile virus infections, of which the majority, 1,112, were acquired here in Europe. That was the highest peak since 2018, which so far had the record. And we had reports of 92 deaths. And alone in Italy, 723 locally acquired cases were reported last year, which was the record to date there. So it's, of course, very difficult to establish the exact cause for the increase in number of cases, but climate change and more warm weather may be contributing to the spread of the viruses by creating more favorable conditions for the mosquito vectors. So we are experiencing a warming trend with more frequent hot spells, longer and warmer summers, and an increase in the frequency and duration and severity of heat waves and floodings. So on the other hand, climate change is only one component because the situation is very complex. And the connection to other factors with an impact on the spread of infectious diseases should be understood and assessed, needs to be understood so that we can the complexity. And these factors include travel, migration, land use, habitat changes, water accessibility and quality. Now, given this complexity, the interventions and efforts also need to address this complexity. First of all, there are multiple actors required. That is a classic field for the One Health approach. And what is needed is research in human and animal health to better understand the epidemiology and diseases in humans and animals, and the impact of climate on the occurrence of such infections. We need research on with a focus on the development of sustainable and eco-friendly vector control measures to keep the mosquito population at the minimum and as much as possible limit the invasion of new exotic mosquito species. Of course, we also need to strengthen the capacity to detect both the vectors, but also the disease. So the laboratory capacity, human and animal cases needs to be enhanced, and where relevant, also the virus surveillance in vectors. So mosquito measures can include very simple measures such as removing stagnant water in the gardens where the mosquitoes can breed. Chemicals to kill mosquito larvae or adults are often used. And more recently, control measures such as the release of sterile male mosquitoes have been applied. Enhanced surveillance and early detection of both travel-related and locally acquired cases of mosquito-borne infections remain essential to implement timely and appropriate vector control and disease control measures. So furthermore, it's also important to raise the awareness among the general public, healthcare professionals, and travelers about the diseases transmitted by mosquitoes. That's very essential. And this includes providing information on symptoms, transmission, vaccines, prophylactic treatment that is available, personal protective measures, also when travelers return to prevent mosquitoes feeding on them, and mosquito population control. So as I said, it's very important to make sure this is done in collaboration across disciplines. In this work, we work very closely with other EU agencies such as the EFSA and also the Environment Agency. And I didn't mention, but it's also very important that these viruses can, of course, cause direct health problems, but they also can cause a disruption of the blood stocks because several of these vector-borne diseases can be transmitted by blood. And whenever there's an outbreak of West Nile fever or dengue, there is a deferral of donors from the affected areas, which can lead to shortages for blood transfusions. And the alternative to install a screening for blood donors is, of course, connected to a high cost. So we will continue to evaluate the risk for EU countries of emerging vector-borne and particular mosquito-borne diseases by issuing risk assessments on outbreaks that occur, either in Europe or in the EU overseas territories. And we also implement regular surveillance of vector-borne diseases, provide an overview of the situation so that countries and the EU Commission can take informed actions to minimize the impact of these diseases at national and European level. And now I hand over to my colleague.
Thank you, Andrea, for this address. And now we go to Celine Gossner, Principal Expert Emerging and Vector-Borne Diseases. Celine, the floor is yours.
Thank you very much and good morning. I would like to further expand on 3 critical points. So first of all, the continuous and rapid spread of Aedes albopictus. So the first detection of Aedes albopictus in Europe was in Albania in 1979. And in 2013, the mosquito was established in 8 European countries and affected 11 and 14 regions. 10 years later, so today, the mosquito is established in 13 countries and 337 regions. While stopping its spread entirely will be challenging, we can act on the density of mosquitoes, meaning the quantity of mosquito in a defined area. And this will have 2 effects. First of all, the reduction of the nuisance, because a large number of mosquitoes impact the quality of life and reduce the time spent outdoors by people, and also limit the risk of viral disease outbreak. Because to have an outbreak, we need to have a critical mass of mosquitoes, and by reducing the number of mosquitoes, we reduce the risk of outbreaks. And it should be noted that all the outbreaks of dengue, chikungunya, and zika that we have had in Europe in the past 2 decades have been driven by Aedes albopictus. The second point is the recent establishment of Aedes aegypti in Cyprus. And there are a lot of similarity between Aedes albopictus and Aedes aegypti, but in terms of assessment, the risk related to Aedes aegypti is of highest concern because it has a very high capacity to transmit viruses, and in addition, it mainly bites humans. This means that if Aedes aegypti bites someone who carries dengue, chikungunya, or dengue, of Zika, its next victim will be a human who will have a high chance to get infected. In comparison, Aedes albopictus is what we call opportunistic, meaning that it bites any mammals that it finds. Additionally, Aedes aegypti has a high capacity to transmit the yellow fever virus that is known to cause very large outbreaks, including in urban areas. As the establishment of Aedes aegypti in Cyprus is only recent, it is crucial to contain its spread and potentially eradicate the vector from the island. At this moment, we cannot exclude that the mosquito will spread to Turkey and Greece, and possibly to other parts of Europe. The third point is a striking increase in number of cases of dengue in continental Europe. So the first locally acquired case of dengue in Europe were in 2010 in France and Croatia. And between 2010 and 2021, there were 74 cases of dengue in Croatia, France, Italy, and Spain. In 2022 alone, so last year, there were 71 cases reported, 65 in France, in 9 different outbreaks, and 6 in Spain. It was 1 outbreak. So this means that the environmental conditions in Southern Europe have become extremely favorable to the transmission of arboviruses, meaning viruses that are transmitted by arthropod vectors like mosquitoes. And we can expect to see more outbreaks of vector-borne diseases and possibly larger outbreaks, and particularly in the light of climate change. So to limit the impact of mosquito-borne diseases, we should act on 5 different pillars. Firstly, individual protection against mosquito bites is crucial. Travelers visiting countries in the tropics and subtropics should use mosquito repellent, and it is equally important for them to continue using mosquito repellent for a duration of 2 weeks upon return to Europe, particularly if they live or if they visit an area where Aedes mosquito is established. And this is to mitigate the risk of local transmission then in Europe. They should also wear long sleeve, long pants, use bed nets, window and door screens, and air conditioning and fans that are effective measures. The second pillar, vector control measures that should be combined with community engagement. And we can cite source reduction, which is a key component of vector control. And it aims at eliminating mosquito breeding sites to reduce the mosquito population. And for instance, eliminating standing water that can be in containers, flower pots, buckets, tires would be essential. For large pool of water, like for example ponds, the use of larvicides that prohibit the moving from larva stage to adult stage can be used. And it's also important to manage the vegetation where mosquitoes are resting. Additionally, particularly when there's an outbreak, we can use adulticides to target adult mosquitoes. And these are effective techniques, but they have an ecological cost. And there are also innovative methods like the sterile insect techniques and the use of Wolbachia that have also shown promising results in controlling mosquito populations. And for this, the community engagement is crucial, as the measure mentioned require an active involvement of the community. So the third pillar is that we should ensure early detection of cases and adequate management of those cases. So we should raise awareness about the risk of infection among travelers, but also the symptoms, particularly for travelers going to the tropical and subtropical countries and the residents of area where Aedes mosquitoes are present. The general practitioner should be able to recognize the symptoms, and the laboratory should have the capacity to timely provide laboratory confirmation. In terms of case management, there are unfortunately no specific treatment against the mosquito-borne disease that we have mentioned today. So case management principally rely on monitoring and providing supportive treatment. The fourth pillar is a timely surveillance to allow assessment of the risk and, if necessary, the implementation of control measures. And information should be collected on the human cases, but also as relevant, like for example, for West Nile, on animal cases. And this should be combined with indicators such as the mosquito distribution, the temperature, the rainfall, etc. And lastly, more research is needed to develop, among other, rapid diagnostic tests, treatment, vaccine, and eco-friendly mosquito control technique that are cost-effective. And addressing these critical points require effort in terms of preparedness and also a One Health approach, engaging the public health sector with the veterinary sector and the environmental sector, among others. And only through this One Health approach, we can limit the impact of mosquito-borne diseases, safeguard public health, and ensure the well-being of our communities. Thank you.
Thank you, Celine. I will now open the floor for questions, and we already have received one. So this is the question from Katrin Gieselmann, Deutsches Ärzteblatt. And here it goes. Your West Nile virus report says that Germany reported 16 locally acquired human cases of West Nile virus infection with known place of infection at NUTS 3 level, while the RKI, the Robert Koch Institute report, says 17. So I will ask Celine to give us the answer to this.
Yes, so I rapidly checked the data that we had in the European surveillance system, and we have indeed 16 cases reported by Germany that are locally acquired cases and 2 imported cases. So the data that we have included in 2022 summary report is data that has been provided until the end of May. We are currently consolidating the data for the 22 for last year. So it's possible that this case, the last case, has not been yet reported to us. The other reason might be that the case do not fulfill the European case definition. But in any case, we will follow up with the German public health authorities to understand better the discrepancy. And we'll be able to come back to you after this press conference.
Thank you, Celine. I hope, Katrin, this is a good answer. And please, if you have questions, let us know. Looks like all is clear, but still, please. Okay, we have a question from Sarah Newey. So please, Sarah, I don't see you, but please go ahead and ask the question.
Hi there, I hope you can hear me. I'm having a few microphone issues, but just a quick one really. Should holidaymakers in Southern Europe in particular, traveling from further north or, within non-dengue zones, not just from the tropics, be careful about picking up viruses this summer?
Okay, I can also ask the question because I have it here. Should holidaymakers across Europe also be aware of the potential risks of picking up dengue or another virus in the southern parts of the continent? Andrea, maybe you can give us the answer.
Yeah, I start and Celine can fill in if necessary. I think it is very important that people going on holidays either in Europe, but also in tropical countries, are aware of the potential risk of mosquito-borne diseases. So I think the first step is really the information. And then it is what Celine said, the measures to be taken, the mosquito repellent, if possible, long sleeves and bed nets and window screens. So to really reduce the exposure. But it's equally important when they return home and experience symptoms that are compatible with one of the diseases. It's usually fever starts such a disease, that they also inform their GPs and their doctors that they have been in such areas, so that the diagnostic can also be directed immediately to these diseases. So I think it starts with giving the travelers the information before they travel, and to me it doesn't matter whether this is in Europe or somewhere else in tropical or subtropical countries where mosquitoes can transmit diseases. Anything to add, Celine? No.
Thank you very much. Hope this answers the question, and I'm waiting for more from your side, so please go ahead. We wait a little bit, so it looks like everything is clear about mosquito-borne diseases, but perhaps you would want to ask some more questions. Okay, it looks like you don't have any questions. I will now close the press conference. I will thank you. I'm thanking you for your participation, thank our speakers, and remind you that please follow us on our social media channels, on our web, and ask the question. If you maybe think of another question afterwards, please don't hesitate to come to us, to our media office. And that's it for now. Until the other occasion, stay healthy, be aware of mosquito-borne diseases, and goodbye from Stockholm.
And have a nice summer.